with open arms. We know the times get hard, and we're here to help at NorthPoint.
Hello, welcome to NorthPoint, Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. We will feature guests from our team here at NorthPoint and around the community to talk about health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we will be discussing listening and talking to adolescents and teens about health. And joining me in the studio today is Mary Jordan. Mary is a nurse practitioner with our Northside Teen Clinic, and we are thrilled to have her today, an expert in this subject, I would say, to share a little bit of wisdom with us. So welcome, Mary.
Thank you, Lisa.
Yes, it's wonderful to have you here. You are such an easy person to talk to, and I'm sure that our guests that come to the Northside Teen Clinic find the same thing. So first of all, before we get into the major content here, would you tell us a little bit about your role here at NorthPoint? What do you do?
Sure. So I'm a nurse practitioner. I've been with NorthPoint almost 20 years, and I've always been separate from the main clinic. I've been over at PYC, which is Plymouth Youth Center, which is an alternative high school, and it's just down the road up on Broadway in Oliver, and I am the main healthcare provider in that school and provide school-based care during the day for the PYC students. And then a few years into my tenure here, we started the Northside Teen Clinic, which is also housed at PYC, but it is set up so that it is for the community members. And so all teens can come to that. And I may mention this again, but our hours for that teen clinic are Monday through Thursday from 3 to 6. And it's open all the time. It's open during school break and summer break. So it's not really related to the school, other than it's housed in PYC.
Wonderful. That's a wonderful partnership that we're able to do that.
It is.
Yeah.
It very much is.
So how did you get into this work? Tell us about your title and what does nurse practitioner mean? And I know you've got some other degrees and certifications, so tell us a little bit about that, Mary.
So, yes, about 35 years ago, I went to graduate school and became a pediatric nurse practitioner. There are different varieties, so to speak, of areas of interest. And I worked actually initially in San Francisco in pediatric pulmonary medicine and worked with cystic fibrosis kids, and many of those are adolescents at that time. And then I moved back to Minneapolis, and I've been working at, I started to work at Coop Clinic, many of you may know, on the south side. And I was there for about 12 years and did a full range of pediatric care, and also started a teen clinic down there also.
Wow.
So we did that on Tuesday. So I've always had this interest in teenagers, yet have also done a lot of babies and things like that. And then when I came up here to NorthPoint, it just, the whole setting was ripe for an adolescent person to be over at PYC. And then the whole idea, it was about 2013 to get really the first teen clinic on the north side. So that is what we accomplished then, and we started it 1 day a week, and now we're 4 days a week.
Wow, that's amazing. Quite the journey. Yeah. Well, I'll say, as a parent of a 24-year-old, teens they can be a little perplexing, especially when it relates to health, right? So many things to talk about there. And so as someone who spent a lot of time with teens, we really want to provide today to our listeners some practical advice about listening and talking to teens and adolescents, right?
Absolutely. And it's a hard subject.
It is.
And that's because it's a hard time. Teenagers are hard because it's a hard time to go through. And we've all had to do it one way or the other. And it's a tricky path.
So let's dive into it. What are some of the concerning topics that your guests, your patients come to you and talk to you about, Mary?
Yes, I think they come with many questions. Certainly probably the majority do focus on their sexual health, all the way from checking out for STDs or how to be safe in relationships, and then also birth control and prevention and all of that. And then we do sometimes often dives into healthy relationships and what to look for if there's manipulation or other pieces. So that is a large part of it. But there's also questions, just as you alluded to, with obesity and body image and how to feel good about themselves, how to feel good about their diet and their exercise and just their shape. And so there's conversations about that also. There certainly are medical questions, and I would say the most that are brought up, that are hesitant to be brought up, are probably the most important ones to be brought up, and those are things that others can see. Acne, warts, or other things that are certainly first and foremost in the adolescent brain of how they're trying to fit in, figure out, stretch out, do what they need to do. So I would say those are our main areas, but we certainly also are worrying a lot of, and the last thing probably is sports physicals, because kids want to play sports, and they come on in and get those taken care of.
Especially here in Minnesota, we've got a lot of sports going on. So I just want to pick a few things out of that conversation, because I want to start with approach. You know, it's different for a provider versus a parent, but again, you know, we want to equip our caregivers, our parents, our aunts, uncles, grandparents. How do we approach our young people when we are seeing things and we need to have these discussions with them about all of those topics you talked about? What's a good approach, Mary?
Well, that is an excellent question. It is the question. So I'm going to spend a minute on this. And what we're talking about, no matter what your relationship is to the child, we think about this as providers in healthcare, aunties, uncles, grandmas, caring neighbors, certainly parents, is trying to create a safe and open environment so that kids, and I'm kind of talking between ages of 13 to about 22, certainly sometimes young adults even older, to create that environment where they feel like they can come and have a safe place. And that's how anything real can happen. So you kind of think of just a few areas, and the first one is just kind of always being there for them. This can start at any time, even though you didn't know them as a child, a young child, or anything like that, but always being there for them, always supporting them, and always loving them unconditionally. And you can't say it enough. Teenagers go running out and they slam the door, and it doesn't, you know, they still hear it, they still need it, they still will remember it later. So just trying to kind of wrap your head around that. The next area is just respect. Respect for where they're at. As I've already alluded to, we all know it's a very tumultuous, transitional, and pivotal time in people's lives. And people need support. All need support. So thinking about respect for whatever feelings your teen or a teen you know is having, in a non-judgmental manner, just respecting what they're saying. And then equally important is respecting the privacy of what they're saying. And all of their different thoughts, no matter how you may disagree with them or they might seem trivial, or however your overlay is trying to take that away and just keep their information confidential, certainly if that's what they want. Presumably that typically is, and that will reassure them more. And all of that can lead to then a whole where the teen and youth feel like, okay, I don't have a big fear here of judgment. You know, there's always that. We all have that. But, or like negative consequences. If I share this with grandma or auntie or mom, how is it going to come back and bite me? But if the kind of foundation is set that these things are true, then that is less likely to happen.
Wow. Yeah.
So then the last thing kind of is just how to engage in those conversations. I could go into that now, or if you want to.
Well, I wanted to pause for a second because that's really interesting to me. I want to go back to this safe place, right? Because a lot of times, I think when our young people become comfortable, it's, you know, not always a situation where it's a direct parent-child relationship or some type of blood tie. I can think of, for myself, a situation where one of my daughter's friends came to me, and she was experiencing some depression and anxiety, and I learned that she was cutting herself.
Yes.
And so, I mean, you talk about your reaction, right? That's what I want to talk about, right? Is what is the appropriate response? Because in that moment,
it's a great example. It's a great question, and it happens a lot. I mean, it happens often, and this is trying to take a moment and think about the teenagers in your home and in your life, that how you would exactly that, respond to that, where you're caught off guard, possibly you weren't expecting that. And the most important thing I could say is just empathy, and stillness, and listening, and intently listening. We call it a skill called active listening, and it's what every human being is hoping for when they talk with someone else. It really is the most effective way for the person who's speaking to feel like they're being heard. So in this case, in that example, she needed to be heard. And in hearing, you can't talk at the same time. So if you can do anything, for some of us real chatty mouths, like myself included, just have to close our lips and kind of calm down and just be patient and see what they bring forth with, and embrace it with comfort, again, compassion, no judgment. And that also comes from nonverbal things. So being careful with those. If you don't agree or you're super upset, instantly you go from 0 to 100 with your emotion. How to train that back, not rolling your eyes, not clicking your tongue, not looking down or to the side. Those are all dismissive behaviors, and that is what instantly changes everything. And no one really, be they 13 or be they 50, excuse me, feel safe in that, and they are not inclined to share more. Clearly she wanted to talk with you because she saw you as a safe person, and that is what we need more of, I think, in this world, and we certainly need it with our teenagers who are dealing with so much. Not only just the hormones of being a teenager as it was 50 years ago, but then all of the other societal pieces that
so much social
we
pressure,
can get into.
So much social pressure.
Right.
And that's one of the things I think too is, there's we have to be careful, as these issues that young people are facing today are very different from how the time when you and I were coming up, right? But they are real. Those are real issues and concerns. And just because we don't understand them doesn't mean they're non-existent, right?
Oh, well,
they're real issues.
Well said. Absolutely, Lisa. That's absolutely right. And, it is... Well, it is just absolutely true. And this has been a really higher percentage of change, I think, than other generations have dealt with. And so our job as any kind of mentor to any young person is, again, if you don't know what they're talking about, or you don't believe it, or you don't anything, right then is not the time to challenge it.
Right.
There can be circumstances like that. It is changing by the minute out there. And but that can be figured out later. But that's not really what they're looking for. They're looking for an open mind, an open heart to just hear them and to hear about it. And then you can go on and you can learn about it if that's necessary. That's another piece of this active listening is not asking closed questions that just give a yes or no question to, but asking open questions, Tell me more about that. Tell me how that makes you feel. What are you seeing? How do you feel from that? Is a way to deal with some of that. But I think it's important, and I want to say that we're not, this is a skill, just like, I don't know, doing a bicep curl. The more you do it, the better you get at it. And if you have young kids, you're already in the parenting throes, but as you are looking ahead, if you can try to be one step ahead of them, which is the most difficult thing, to think about how to do some of these things like we've mentioned, like be patient, don't interrupt, empathize. That is your first response, empathize. No judgment in the questions, no judgment in the nonverbal, as I mentioned. Dismissive looking away, certainly rolling eyes or clicking tongues or anything like that that is natural human behavior when you don't agree, but it is not helpful at all in that circumstance. And also, you know, sometimes we even can just kind of say back, is this what you're trying to say? I really want to understand it. All they need to do is be heard and believe that you want that too. And you don't have to be any expert, you don't have to be a counseling degree, you just have to be present and look at them, you know, have good eye contact and care, and that all that emotion will come through to someone who's looking for some help. They also want the truth. I think it's important to be honest as far as you can be in the moment of what you know. And the only other thing I wanted to add just was us as parents and grandparents and all people dealing with youth, you know, we have to kind of be ready and willing to talk about these hard topics. Often, especially parents possibly, are just like, okay, I'm not talking about that, go talk to Dr. Joe, or don't bring it up, or they make it so hard so the child never does bring it up. And you know, their life for those 10 years or so are extreme. It's extreme, think of it that way. And those things need to be dealt with. And that's how you can help them work through it and work through to good resolve and good decision making. I mean, these are lifelong skills that get so laid down in these teen years. And doing them incorrectly sometimes can get laid down, and then people have trouble with this type of communication.
So what do you do with an adolescent or a teen who really, they're not able to express themselves, right? We see that comes out. A lot of times it manifests as anger, right?
Absolutely.
How do you have those conversations when someone comes in and they're just angry about everything that's going on in their life? How do you break that down?
Well, what I would first say is probably right then is not the time. So again, it comes back to being patient. So if there's a storming teenager, there's a lot of things going through, and you may feel, okay, there is something we need to speak about. I would really encourage all of our listeners and anyone who loves teenagers, which is all of us, you know, to try to find the space and create the space. It often can't happen necessarily on your timeline. It happens at 1 in the morning. I think a response to your question, Lisa, specifically is just, let's just calm down. And we don't need to talk. We're going to take some deep breaths. I'm going to go in the other room. You go do something, and come back to it when people can at least feel like they can try to express themselves. Otherwise, it becomes what is so often the case, emotion crashing between parent-child, auntie-child, whatever, and then it just is absolutely unhelpful. So that would be how I would present that, and that just takes time and energy and intention. And that's kind of what I was trying to say at the beginning, intentionally trying to have these discussions. And I also might just add that it's also when the teen is ready. You know, you may feel like they're doing X, Y, and Z, and we need to get into this. So the foundation needs to be laid for some of that. Obviously, we all know we can kind of drop a few hints, see if the bait is taken, so to speak. Oh, yes, I am ready. Or, yeah, Mom, okay. No, not now, maybe later. However it may come across, just don't leave it. Don't just drop it. And if it's today, or it's 2 weeks, or it's a month, it will come. And if it can be started by them, that's, of course, generally the most productive.
Well, and I think one of the things that you said is just so true, is that being available and being around, because I think with that particular young person, the reason she felt comfortable coming to me was, you know, I was always the mom that was driving everybody and having people over, and just created a space in my home where, hey, I'm in the kitchen cooking or doing whatever. They're going to come. They're going to sit down, and that's when, you know, you wait for them to come to you a lot of times.
That's exactly right. And that is really hard, because people are working, and they're working 2 jobs. And sometimes that happens, but it doesn't necessarily. When you get home, sometimes even if it's late, you know, just a touch on the shoulder, or is everything okay? Or I'm here, you know. And kind of back to what I first said, reminding them you're always there, even though you had to be at a shift from 3 to 11. But I am here, and I'm open and want to be a help. And I think just those little things, space is found.
Yeah.
Even if you are not the one who gets to have the lucky role that you did to some extent, I just, there's all sorts of ways of connecting, and it sometimes happens at 1 in the morning.
Sure.
But it can and will happen.
Absolutely. Well, one of the things I want to talk to you about today is the role of technology and social media and those conversations. We are seeing so much. I mean, we don't even fully understand the impact, to health that this is having, because these studies are still ongoing. But can you talk a little bit about that, Mary? What you're seeing and.
Well, I can, and I think it's nothing that is what most of us are seeing. Unfortunately, the jury is out, although we're certainly seeing trends of, hurt to kids, hurt to children. If they start at 6 and it's all through. So I certainly talk about that when I see kids. I talk about it with my own kids. I talk about it with the neighbor kids, and I talk about it with all my patients of who exactly is putting this material onto social media.
Yes.
And sometimes kids think, just like we all thought, that all adults do the right thing.
Right.
And just kind of highlighting that, like, no, this is someone who wants to make money off of your back. And it's often the way I actually just talk about with vaping is another example of that, where we don't have the studies to show what this could be doing to your body, and we will know in 20 years, but no one cares who's producing it, because they're making a ton of money off of you. And sometimes that can be a helpful way for kids to really kind of reshape it and think about it. I don't badmouth all things on the internet, as we all know. There are very good resources, and there are very good teen health resources, and certainly the majority of kids go there for their information. But there certainly are places that are more sketchy and not accurate. I think when teens are looking for health information, I think the thing to remember as a teenager or as a parent or adult with a teenager is that it's really specific to each person, and that the only person that can really help you with that is to go in to a teen clinic, go into your school-based health clinic, and talk about yourself specifically. Your friends have ideas, your cousins have ideas, your older brother has ideas, and they will all share them, because we all do. But just to remember that is, can lead down the wrong path.
Sure. Yeah, let's make that plain, that not everything that you see on social media is true, is accurate, or appropriate for you.
Well,
that's what you're saying.
True. That's exactly what I'm saying.
Yes.
And that's tricky when there are not, it's coming, or we're hoping for more and more, barriers to some of these places, these sites and things like that where kids can't access them. Certainly, I would encourage parents, if you have a plan or a type of phone, that you can be involved and try to block some of that stuff. I think that's easier to do. I am certainly not the expert on it, but I would encourage you to look into it.
What can we do as adults to encourage teens to take more of an active role in their health? What are some things we can do?
Great question. I mean, think of this whole teenage time as practice to adulting, right? And this is just one of the other steps. They need to learn financial abilities, how to do that. They need to figure out how to, communicate, wash their laundry, right? Do all those types of things.
Like
they need to learn to cook. They need to learn to take care of themselves, and that's all the whole health and wellness around that. So I'm a firm believer in school-based health care, and so in Minneapolis we're lucky in our high school at PYC and at North and at Henry and Edison. All of those have school-based clinics in them. Right. So with parental if it's for medical reasons and things, then the child can be seen alone, and they get checked in. Like at our clinic, they come, they get checked in, they kind of go through that process. Discussion about insurance. They just start practicing. And our job as any adult is to just nurture that. No one knows how to do it unless you show them. And it's difficult to do when you're 45 to navigate our health system in this country. So, so I very much believe in school-based health for that reason. I believe in teen clinics that we have about 3 around the city and out in attached suburbs where kids can go. If it is a sexual health nature, they can go there confidentially if they would prefer to do it that way. And then they also learn that process. They walk in themselves rather than their parent checking them in. And then they are sitting with the provider talking about what it is that they want to talk about and what they're worried about and concerned about. And all of that is a way to help them, I think, learn about what's important, learn about what they need to think about, because you know, we are screening kids medically, I'm speaking of, you know, at younger and younger ages for things that can cause a heart attack in their 5th decade when they're 50 years old. So now we're screening for that at 9 and 11 and at 17 to 21 or something, just to check their cholesterol levels and things, because these things start early. And those conversations about blood pressure, weight, cholesterol, diet, exercise, meditation, mental health, you know, self-care.
Yeah,
and it's really self-care has really not gotten the attention. And I often, whenever I can, I use that when I have a patient come in and they're talking about, and this is another thing about active listening, you know, asking, well, what have you done about that? And getting them to engage. And then they tell me and I go, you are doing self-care. You are doing what I would suggest. You know what you need, you know, as far as meditation, going for a walk, you know, cutting down on McDonald's hamburgers, whatever it is, you know, people innately know. It's good to get, of course, accurate medical information about specific things, but in general, good health information is out there at the ready, with good resources on the internet, and then your friendly clinic with nurses, nurse practitioners, and medical doctors.
NorthPoint is a community-based organization. We serve our north side population, but also, you know, our other community partners. What can we as a community do right now for our young people? What can we do? What's the call to action?
I think what we can do is pay attention. We can pay attention to the people who want to get into office and see what their platforms are around youth and support of youth. We can pay attention in our own backyard. We can pay attention on our own front sidewalk. We can be a parent to a much larger group, I believe, is really what we can do starting tomorrow. You know, we need continued support, and we need continued support for housing in our community, and healthcare, and just avenues for kids to thrive and be their best selves. To be their best selves, they need to come into a clinic regularly and get checked out. They need to have some athletic outlet possibly, or just exercise outlet, so we need more of that area. And I just think that if people can take a part of their time and their brain and just be intentional about youth, that will serve us all well.
Well said. Well said. Well, I want to thank you, Mary, on behalf of the community for all your work that you've done here on the north side. I mean, 20 years, that is dedication. So thank you. Thank you for your commitment and for bringing your talent here in our community where it's needed. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know that times get hard, and we're here to help at NorthPoint.
And I was going to ask you about that. Are there some general regulations, or I shouldn't say regulations, but recommendations about annual physicals and things like that that you would share with the audience?
Well, certainly there's, they're probably familiar with the term well child check that has been around forever, and that's really a yearly event, and certainly all insurances pay that, all the state insurance is paid for a regular annual check-in. And, and when I have a 14-year-old come in, and I'm certainly listening to their heart and looking at their liver and things like that, but mostly I'm talking with them about the risky stuff that teenagers engage in, because that is what hurts teenagers. Doesn't mean we don't do the other stuff, but it gives a forum to do that. Now, I also just want to say that when kids come in for other reasons, they're worried about a mole, or they're worried about their acne and wish that it was not as strong as it is, or something like that, I still engage in all of those. Really, we call them risk factors that kids are either into or not, or have tried and have left behind, or are thinking about, because that is what is important at the visit. Sure. At this age, usually. So it's certainly good to get your kiddo in every year if you can do that. Sports physicals help that process. Sure. Getting regular shots and vaccines. There's a vaccine that people just a couple of years ago became mandated in the state of Minnesota. It's the second meningitis vaccine. And so it's somewhat new to some people. So they got one at 12, and then they need one after the age of 16. Because what it does is it prevents that bad disease into your 20s. Sure. So if you just have the one back at 11 and 12, you're then susceptible at 17, 18, 19. So that after 16 vaccine is a nice time to get your kiddo back in kind of for that late adolescent visit.
Well, and then here's a topic, again, from personal experience and having friends who have younger children. My daughter, as I said, is 24, but who have children that are still in high school. And I was not faced with this. I'm sure it was going on, but children that the social pressures are so tough that these kids are taking their own lives, Mary.
Well, yes, and it has just been the crime of the last 20 years, really, is looking at how and understanding how these things have affected kids, young kids and young teens, all the way through till 24. So it's absolutely true that there is horrific content, and then there's just horrific communication between groups of people in high school and junior high, for young girls, for young boys, for all sorts, and for groups of kids who are not represented in the majority. It just is very, very hard. It is hard. And so as much family, community support that we can give these kids to know they are loved for who they are, that there is someone who has their back, that whatever it says on there is to try to swipe left or whatever. It sounds like it's not very helpful. I realize that. But I think checking in with kids more often is what we are now being called to do. Okay. Really, I think that's the most helpful piece we can come up with. These things will be better in 20 years, but that won't be our group right now. Right. And I just want to impress on parents how much influence they have. They may not feel like they do, but study after study, scientific study after scientific study has shown that the parental influence, and even the influence of a nurse practitioner or a medical doctor or a counselor or a physical therapist, has a lot of weight in kids' minds, and they remember it and they think about it, and it helps them to stop maybe and to think about something else, or to seek a better path or more help if they're struggling with something.
Well, I want to ask you, someone with lived experience and someone who's a mandated reporter, what do you do in a situation when a young person comes to you and, they're really in crisis, right? And they are at a point where they could harm themselves or someone else. What do you do there, Mary? How do you handle that? How do you talk them? Where do you go?
Well, excuse me, it is very much dependent on their age. So if they are under 18, that is absolutely mandated reporting to their parent And so we talk absolutely openly about that. And if they're unhappy, that is the family is the first place we go. And then there are certainly resources, crisis resources, and all of those things as we make judgments. And we have, I feel like I need more help in that area, we have therapists at site to help make more of an assessment if that's necessary. Hennepin County, we have people that come out and make those assessments. So if kids are children and they're not adults, that is where we go to the parent. But if they're over 18, then they're adults and we treat it as such. And I would, again, continue an assessment and make sure, and if it means a real mental health assessment team coming in, we have those resources at the ready. So they can come to the clinic if I have a patient who I am concerned about that could happen to, and we would get them looped into a path that would get them help.
Sure. Okay. Okay. Is there a place where young people and those caregivers around them can find some of these resources?
There's one specifically, it's called teenhealthwellness.com, all one word.
Teenhealthwellness.com.
Yep. And that does cover the whole spectrum of vaccines and things like that. And then I have two others that I really are the ones that I go to and I tell my patients about for sexual health. It's bedsider.org. And it's myselfmyhealth.org, which is out of Hennepin County. And it's quite good. As far as other resources there are, when you're set up on the state insurance plan, there are phone calls and there are mailings that come out that talk about what your child needs at each stage. So that is certainly true. Sorry, I don't have a website right off the top of my head.
No, that's really great. I know that we have a high population of young people who are in transition and who don't have housing. What about resources for them? Where can they go?
Well, whenever they come to me, when they come to our clinic, we are doing a whole health and wellness assessment. And so then resources of the food shelf of NorthPoint and other Hennepin County housing situations I have that information.
So you're taking, when you have a teen or adolescent that comes in, you're taking a holistic approach, which is one of our pillars here at NorthPoint, but you're taking a holistic approach to whatever their situation is, right? You're looking at all of it. Food, access to food, health care.
Because none of it will work unless those things are at least addressed to some extent. We certainly, so there are mental health providers at the ready, there are food shelves at the ready, and there are homeless specialists and different things, and again, resources that I hand out to send them to a spot of people that can help them. You are so right, Lisa, that can't be said enough, especially with teenage care, because all facets are all firing at once in their brain and everything else, and all these things are affecting how they're going to respond to any of the information I might have told them about their birth control or any of that. So, and that's true for all humans, but I just think it's just so much more acute in teenagers because seeing forward is hard for them sometimes.
I love that. Seeing forward is hard. It's hard for us too.
Yeah, it's hard for everybody.
It is hard.
Okay, then you just take a brain that's kind of, again, firing from all directions. That's really hard.
I wanted to ask you, I want to go back to, you were talking about, you're clearly very passionate about school-based healthcare. And I was reading, I don't know, are you still on the board of the Minnesota School-Based Health Alliance? Can you talk a little bit about your work there and what you do?
Well, I absolutely am excited about that. I was not a founding member, but I've been on that board for several years, and we're just very pleased. So this is the Minnesota School-Based Health Alliance that is a national program, but we're the Minnesota Alliance. And as strong as Minnesota has been on healthcare things, we have not been strong on this, strikingly. And now, just in the last, with help from the state and from a federal grant, we have now become a 501c3, meaning a nonprofit. We have paid staff, counting 2, and we're super excited. So we went from about let's see, I'm rough here, about 12 school-based clinics, mostly in the metro area, to now I think we're up to like 25. Oh, it's fabulous. And in fact, I just hosted at my home a board retreat for this group to kind of review where we've been and how we're going forward. And the work that we do includes technical support for emerging clinics and helping them figure out how to bill and how to connect with a group that can support them to some extent. And then also just advocacy at the legislature and trying to get things passed. I mean, that has just been ongoing work for people that I'm standing on their shoulders way back.
Wow.
So it's cool.
Very important work. That's a lot of growth, too, to go from, you said, 12 to 25.
Well, you start getting something in place that people can see and hear about and come down to. We had people from Moorhead that came to this board retreat and from from Rochester.
That's amazing.
So it was just exciting. And because this is what we need in this country. We need healthcare where people are, and there's no better place than school for kids to access their own and begin the process of becoming a good caregiver of their own health.
Oh, yeah. I love that. I love that.
So